Hello, everyone. I'm Eric Bolling, along with Eboni K. Williams and Kat Timpf, and this is the Fox News Specialist. Thank you so much for joining us today on the inaugural episode of the Fox News Specialist. Every day, Eboni, Kat, and I will be discussing the day's biggest stories, but here's the twist. We will be joined by two specialists for unpredictable and unexpected commentary. Let's meet today's specialist. He started his first company selling garbage bags door-to-door at age 12. Since then, he's developed businesses and invested wisely, earning him billions with a B. He doesn't golf, but he does love basketball, so he bought the Dallas Mavericks, an NBA franchise, and he specializes in all things entrepreneurship. He is Mark Cuban, and he is here. And he's the co-producer and co-host of The Circus on Showtime. He's worked on big league presidential campaigns, namely George W. Bush and John McCain's presidential bids. He has competed in 2 Ironman competitions, and his specialty is Nashville songwriting. Mark McKinnon is here. So on day one, you guys, we have 2 specialists, Mark and Mark. Welcome, gentlemen.
Thanks.
Thanks for joining us on the first show.
Absolutely.
Cuban, I finally get you in studio sitting next to me.
Here I am, and I'm wearing a suit.
And you look great. And
I know.
Mr. McKinnon.
Humble by Cuban.
Congratulations on the show.
Thank you.
And a big get this morning.
Congratulations.
We've been working together, the 3 of us, for a long time, but never together at the same time.
Going back to cashing in, baby. Here it is.
You all get carried away.
Oh, yeah.
Want to get this party started?
Excited. I'm very excited to party right now.
Guess what? 5 o'clock will never be the same.
Never.
All right, let's get today's top story. It's been one of the president's biggest promises since he hit the campaign trail: repeal and replace Obamacare. But thanks to what's being called Obamacare Light, Republicans were unable to seal a deal with Paul Ryan's plan. But reports swirling around today suggest they may finally be close to reaching a deal on health care. A senior White House official telling Fox a vote to repeal and replace Obamacare could happen as early as Wednesday. Earlier today, I sat down with the president to discuss this, amongst other issues. Here's what Mr. Trump had to say. Health care, we're going to get that passed?
I'll do the best I can. The one mistake I made with the health care, we have one plan that's been going through. It's been getting better and better and better. And somebody was saying, oh, the people that voted for Trump aren't getting good. They're going to get the greatest. These are the greatest people. We're either going to have a great plan or I'm not signing it. And I've said from day one, the best thing I can do is let Obamacare die and then come in with a plan. But it's not fair to the people. So, it's going to be very good. I don't want to set deadlines. I think it's going to be approved. It could be soon, but it could be not so soon. It's going to happen. But remember this, I've been really focused on this for like 7 weeks. That's 17 months.
All right, Eboni, so we make it a vote this week, and boy, I got to tell you, that was a hard-fought vote that he may be earning.
Yeah, certainly. But you know what I'm more concerned with, Eric, is instead of just getting a fast vote, something that's actually better. That's my thing. I've never been somebody fighting necessarily making Obamacare better. If you need to repeal it in order to do that, I'm not really beefing with that. But these harsh deadlines, the best thing I think President Trump said there is, I'm not concerned with the deadline. I'd rather get it right, however long that may take, than something fast and that's no better than what we currently have now.
He needs this, though. I mean, they decided that was the first thing they were going to do coming out of the box. Health care, that's a big initiative to take on first.
They should not have done that, in my opinion, and I did not like the last plan. It had the same pitfalls as Obamacare, and I agree that they should wait to find something perfect, but at the same time, not doing anything is making a decision. It's like if you're with your friends and you're arguing about where to go to dinner, you want to go to a really good place, but if you argue too long, the only thing that's going to be left is, the diner with the waitresses that smell like cigarettes and broken dreams and don't have teeth, which would be like single payer in this case, which nobody wants, and then nobody wins.
Yeah. Let's talk a little bit about the politics of this.
Here's the challenge. They were able to get the Freedom Caucus on board because they now have in the bill an option where it goes to the states and the states can opt out of things like pre-existing conditions. The president said yesterday that he says pre-existing conditions should be in it. They should be guaranteed. Well, if they're guaranteed, then the Freedom Caucus is going to have a problem with it.
Well, because prices will go up if they're guaranteed.
Sure,
you want to have everything, and it's an emotional thing. And, of course, you want people to be, of course.
Look, who's going to take less? The stakeholders are the health care providers, the insurance companies, and the patients. who gets less?
And that's really the thing that nobody wants to say, though. You're exactly right, Mark Cuban, because under what we currently have, there's no way for more people in America to have coverage, which is a goal of Obamacare. Probably the only thing it successfully did, 20 million more covered, but it is so much more expensive, and you cannot do both at the same time.
Can I jump in and give you the conservative version of why I think everyone can do better? We can have lower premiums, we have lower costs for health care by providing competition. Mark, you know this is one of the most important things. But hold on, let me finish this. So my biggest problem with the original bill was that it never allowed for health care across state lines. Competition drives down prices,
let's look at this like a business, right? How much do you think premiums could go down?
Premiums or health care?
Premiums for health care.
Well, how's this? How much can health care go down? I'll tell you how much premiums can go down.
Exactly, right? So have you seen any stock analysts downgrade any insurance companies at all? Have you seen them say, look, they're going to sell more policies based off of this? No, because it doesn't play out. Just because they want it to happen first doesn't mean it's the right thing to do. And they better be careful what they ask for, because it's not going to work the way they plan.
Guys, my biggest concern, it doesn't happen at all. I mean, the promise is, Mark, is that it'll happen in phase 2 or phase 3 of a health care bill.
It's got to happen, and the worst thing that could happen would be to roll it out and have it go down again. So, as you said, Eboni, he should wait, make sure and get it right this time.
Here's the irony.
You don't want to strike out.
Here's the irony of the whole thing.
It'd be a disaster.
What was the number one thing Obama had to do when it came to selling the ACA? He had to get as many healthy people on it as possible. If and when this passes, what's the number one thing President Trump is going to have to do?
Give it to the mandate?
Well, no, because of the tax payment that you have to make. He's going to have to go out and sell as many healthy people to sign up as possible. And if he doesn't,
it won't be otherwise.
It's going to be the same problem that we have now. We're going to
the irony is he and Obama have the exact same challenge.
Yeah, you know why?
The plan did the exact same thing. Just because you have to be penalized by the insurance company instead of being penalized by the government, you're still being penalized for not buying something. I'm always going to give a thumbs down.
An inflated health care package that doesn't really make life better for you.
There's a reason why things that are covered by insurance have been rising in price, and things that aren't covered by insurance have been dramatically decreasing in price, because there's competition in one area only.
Absolutely, and you hit the nail on the head. When you remove that mandate, Mark, and then you are forced to get healthy people on. If you don't have the mandate, healthy people say, look, I'm not going to do that. It's too expensive.
Exactly.
We pay out of pocket. Yeah.
But, McKinnon, what about this? What about the Freedom Caucus, who now all of a sudden is on board? Somehow they were fighting it, and now they're on board. And I defended those guys tooth and nail for a long time, and I'm going, wait a minute. This isn't that different, but you're on board?
Yeah, well, I agree we got to expand the state pools like you're saying, and the Freedom Caucus. I like the federalist approach, but give it back to the states. If they want to take out pre-existing conditions, let those governors deal with the politics of it. That will work. But
what about the health care of it? I mean, the politics are one thing. What about the people?
You know about the quality of health care, Mark Cuban?
Yes.
Yeah, and I think that's what is not being talked about. I was discussing this with a very good friend of mine who's a practicing physician. He said that's the thing. We're talking about health insurance and health care, like as if they're very different things. And they're not. They're not at all.
Yeah, the best thing would do just get the health insurance companies out, right? Why do we need insurance companies?
I agree with that.
The day has come where I think we can go however you want to.
You know what you're talking now, though.
Insurance is supposed to be catastrophic things only.
You're
not
talking
any little thing.
worst of all worlds in libertarian land, which is single payer.
Right, but we have de facto single payer because of all the risk pool money that both plans put up. Right? We pay it through the back door right now because they're doing, what, $150 billion for risk pool and more under Obama. It's de facto single payer. We all pay in to pay everybody's
insurance companies, with that system, then it's not really patient-centered because the customer isn't the patient, it's the insurance company.
The key is to make the pools bigger. That's what you got to do. Break down the state lines.
Right. Rand Paul would say that, but that would bring the insurance costs down. It doesn't bring the health care costs down.
No, it's exactly right.
You're exactly right. But the way to do that is to provide competition. Right? Let a hospital compete with another hospital.
Well, then get the insurance companies out of the way, period.
And how are these doctors going to feel, though, Eric? I like your idea of competition. It will drive down premiums and prices. I'm worried about how it will affect health care itself, because if people are getting less, far less, right, for the coverage they're providing, I don't know how we continue to incentivize the quality if it starts being that cheap, so to speak.
Well, I get patient-centered, make doctors answer to patients, not insurance companies.
In a quarter of the states, or almost a quarter, you now have just one insurer. That won't work.
Yeah, it's a hot mess.
You know what the news is, though? It's big news. Healthcare, people care about healthcare.
You know what? And this stuff is hard.
It is. And guess what?
I'm not,
we had fun talking about healthcare.
Hard stuff.
That was hard.